Hello, I am Dr. Pankaj Sarode. I am a senior gynecologist and head of the Department of Pelvic Reconstruction and Cosmetic Gynecology at Ankura Hospital, Pune. Let us today talk about hysterectomy. Hysterectomy is a scientific terminology for the surgery where uterus is removed. Uterus removal surgery is probably the most common surgery women are facing throughout the world. Every woman has a chance of 1 in 4 to undergo hysterectomy throughout her life for some or other reason. There are different reasons for hysterectomies which are performed, like excessive bleeding during menstruation, which cannot be controlled by using medicines, or because of the fibroids which arise in many women beyond the age of 35, which cause pressure symptoms or cause increased bleeding during menstruation. Now, hysterectomy can be performed by 3 methods. They are known as abdominal surgery, laparoscopic hysterectomy, and vaginal hysterectomy. Now, abdominal hysterectomy is a method by which uterus is removed by taking a large cut on the tummy, like we do for a cesarean section. We need to cut tummy to the size of about 10 to 15 centimeters. After that, surgeon puts his hands inside, detaches the uterus from its attachment which are naturally there, and takes out the organ. This is a traditional method, but the disadvantage with abdominal hysterectomy is that it is more invasive. As we already discussed that we need to take a large cut on the tummy, so it takes longer time for recovery. Healing takes about 1.5 months, and the patient would be bedridden for at least 24 to 36 hours because of this large cut on the tummy. So to overcome these disadvantages of abdominal surgery, over the last 25 to 30 years, laparoscopic hysterectomy has come into the picture. Now, laparoscopic hysterectomy is technically like abdominal hysterectomy, but rather than taking a large cut on the tummy, we make 4 or 5 punctures on your tummy. Through one puncture, we put in a telescope, and through other punctures, we put in instruments through which we manipulate and detach the uterus from its natural attachments, and the organ is taken out. This is quite common nowadays, and many of you are aware of this kind of hysterectomy also. What many of you don't know about is a vaginal surgery. Vaginal hysterectomy is a surgery where we take out the uterus without taking any cut or any puncture on the tummy. That is, through the natural passage of vagina, the uterus is taken out after detaching its natural attachments, which otherwise also are done for abdominal or laparoscopic hysterectomy. Now, this vaginal hysterectomy is considered as the least invasive mode of hysterectomy because we are not taking any cut on the tummy. The procedure is absolutely painless. We can expect the patients after surgery to start walking around within 3 to 4 hours. The hospital stay would be just 12 to 24 hours, and the recovery is very fast, like patients can resume their daily routine, going to offices as well within 3 to 5 days. So you can see that vaginal mode of hysterectomy has immense advantages over any other modes of hysterectomy. And now, with modern advent and few developed advanced instruments, when vaginal hysterectomy is done, it becomes practically painless and a daycare surgery. Daycare surgery means one can expect to go home on the same day on which the surgery is performed. This is amazing. The results are very surprising. Here at Ankura Hospital, our team has done more than 2,000 hysterectomies by this method, and almost all kind of uteruses where the hysterectomy is required can be performed by the vaginal route. So almost 90% of the women who need hysterectomy can avail this method of hysterectomy and enjoy the benefits of vaginal route of hysterectomy. So in case you are advised hysterectomy by your gynecologist, please don't forget to discuss about this vaginal hysterectomy with your doctor. If you still have any doubts about this method, or if you want to discuss about this, you can put your comments in the comment section or contact us directly at the Ankura reception. Thank you.